And we are talking about again the ECG and echocardiogram also has to be done to rule out any risk of cardiac diseases. As we know, like there is myocardial infarctions and stroke, and there is coronary artery diseases, and all those things. And also pulmonary function test should be also considered for patients with shortness of breath and the evidence of any pulmonary disease. And the EEG also, there could be chances of causing seizures and prodromal symptoms, which commonly seen in kind of anxiety. And these investigations are commonly asked to be used to investigate the anxiety. And very specifically, we have scales, different scales, which are commonly used to assess the extent of the anxiety issues. One of the very important is Hamilton's anxiety rating scale. You can see here, it's a little bit small in view, but there are a lot of questions which talks about here. You have to do that few reasons answer for it, and there is a scoring system. And there is also the another one is Beck anxiety disorder inventory, BAI. It's also a manual which talks about to assess the anxiety. So they usually use this scales to assess what is the extent. So these scales are also used as for checking the efficacy of a drug. They use before starting the drug what is the score, and after starting the treatment this check that. Okay. And for anxiety of this. So as I told in the treatment, we have two different options: the pharmacological and non-pharmacological psychotherapy. It's quite very commonly. Coming to the pharmacological treatment, so there are three major neurotransmitters which are targeted in pharmacological treatment of anxiety disorder. Like we have GABA, which usually the benzodiazepines acts on the GABA receptors, which is an inhibitory receptors. Okay, so and also selective SSRIs are used, selective serotonin inhibitors. Serotonin is most commonly acts on these receptors. Okay? And also the SNRIs, that serotonin norepinephrine receptor reuptakes, that is the norepinephrine receptors it acts. It acts also on both serotonin and norepinephrine receptors. And we have seen a lot of these mechanisms in the last class, in the class of schizophrenia and this. And very commonly used is the benzodiazepines. You can see here, it's a well-known drugs, most commonly used since long time. Their profile, they're known to be used in the patients. Okay, so it's an anxiolytic drugs. It acts by enhancing GABA actions. So it's a potentiatic GABA. As you know, like in anxiety, the GABA receptors down regulation, that is inactivity of GABA receptor occurs. So, but here it is enhance the GABA actions, and at the level of amygdala, and also at the level of prefrontal cortex within the CSTC loops to relieve anxiety. Okay, so this is the two main regions where the therapeutic actions of this one. You can see this. This is the GABA neuron, which is there, and GABA acts on this and increases the area. These are the areas of normalized activations in the brain, and because of this, the GABA action is increased. The feared treatment will not come. Same way, the worry, both fear and worry will be counteracted by the benzodiazepines use. Okay. There are three major types: 1,4 benzodiazepines, 1,5, and 1,2,3 benzodiazepines classifications. So 1,4 benzodiazepines, they are very widely used anxiolysis. They cause sedation, muscle relaxation activity. But problem with this benzodiazepines, this class of benzodiazepines is cognitive and psychomotor impairment they may cause, the drug itself. The other major issue is addictiveness. So this is the most commonly seen in a lot of benzodiazepines things, the addictiveness. So the decrease in the addictiveness also should be there, should be considered for this. The example of drugs is lorazepam, clonazepam, oxazepam, flunitrazepam, chlordiazepam, and diazepam, etc. So if you see this here, a lot of the drugs is used, like diazepam they use morely, but it's again having issues with the respiratory inhibitions. It causes respiratory breathing problems. And the chlordiazepam again, there is long acting drugs. And very commonly now we use lorazepam, clonazepam, okay, because they does not involve in drug interactions also, very few interactions are seen. 1,5 benzodiazepines, clobazam, it's more having the anxiolytic property, anti-epileptic property. So if the patient is having anxiety with seizure, then clobazam is one of the choice because it controls the seizures as well. And importantly, like unlike like others, it causes decreased sedation, low dependence, low muscle relaxation, but can be used in executive groups and continued for a long period of time. So that's how the advantages of this clobazam over other benzodiazepines. And 2,3 benzodiazepines also it's there where it's bind to 2,2-benzocyte. So its classification is based on which subpart of benzodiazepines it it get linked in the brain. Okay, so the drug here is tofisopam. It's also a racemic mixture of 2,3 benzodiazepines combined. It's comprised of our racemic and R and S enantiomers, and also traditional one benzodiazepines. So it mainly binds to benzodiazepine sites in the 2,3 benzodiazepine sites in subcortical area. It does not bind to GABA receptor complex in cortical areas. Because of this, there is a better resolution of anxiety and existing depression without sedation, muscle relaxation. So this is again in the typical, you can see that in 1,4 benzodiazepine, this was common issues. So in this cannot be seen. There is also a clinical trial done here, which is usually suggests it would be useful in anxiety disorder, anxiety neurosis, mixed anxiety depression, somatoform disorder, alcohol withdrawal, and menopausal syndrome. So it's itself is a very important compound. But I don't know how much it's available in the market. Okay, but it's a new drug which is like having even the advantages. If we see, it has anxiolytic properties, but unlike other benzodiazepine, does not have anticonvulsant. But it does not have that, but it can, while it may not be an anticonvulsant in and itself, but shows to enhance the anticonvulsant activity of other classical drugs. But it does not as its own anticonvulsant property, but it may potentiate the action of other anticonvulsants. And also sedative skeletal muscle relaxant and motor skill impairing and amnestic properties are very widely, rarely seen in this kind of. The next class of drugs in anxiety is selective serotonin reuptake inhibitors. Sorry, there is an uh, typo error here. It's not inhibitor, it's an inhibitor. So, as you know, like 5-HT is one of the very important neurotransmitter which are involved in key neurotransmitter which involved in all those the anxiety. This one it's innervated in the amygdala and also in CSTS circuits and also in prefrontal cortex, striatum, thalamus. So it regulates both fear and worry. So The antidepressants which you can serotonin by block the serotonin receptor, as you know, like it's also 5-HT receptor reuptake inhibitors. So we have seen in other class also. So the reuptake of serotonins, uh, the uh, neurotransmitter is inhibited. Because of that, that serotonin remains longer time at the nerve junctions, that is synapse place, and also controls the anxiety. It's also effective in reducing symptoms of anxiety and fear in every one of the anxiety disorder. It's again, you can see here in the pictogrammatically 5-HT neurons. So it also same like benzodiazepines. It also reduces the worry by acting on different the receptor sites. And also here you can see amygdala, and along with other associated sites can also controls the fear. Are you all following? Any questions here?
No, sir.
No, sir.
So no questions.
Okay. So some of widely used SSRIs here is the fluoxetine, paroxetine, escitalopram, sertraline, and fluoxamine. So even in the other class, we have seen a lot of change difference between these drugs. Like the side effects commonly stomach ache, increased activity level, insomnia, agitation, and also disinhibition at higher doses. And less often diarrhea, headaches, and tics. Tics is something which is more of sound system, which causes cramps, twitchings, and sexual side effects. So all these drugs should be started at low dose and increase and titrate the dose slowly based on the treatment response and side effects. So it may take almost 1 month to 1.5 months to reach the maximum dose of these drugs. So it should be titrated very slowly. The third kind of drugs which is used is norepinephrine reuptake inhibitors, okay, and also selective norepinephrine, which causes mainly in the block the norepinephrine. So as you know, like norepinephrine also is involved here. So in the measures, you can see hyperactivity of CSTS, which is usually causes more of worry. So this norepinephrine action on any neuronal output will block the formation of the worry. But the another thing you can see here when compared to the other two class, benzodiazepines or SSRIs, but they both contacted was able to trap both fear and worry. But here the norepinephrine reuptake inhibitors can only block the symptom of worry. So not because they act only, the neurotransmitter is responsible only for the formation of the worry, not fear. And some NRIs and SNRIs commonly used, which is serotonin, norepinephrine, both, as I told, some drugs has affinity to both the receptor, serotonin and norepinephrine, and some norepinephrine reuptake, they are only affinity to the norepinephrine. The drugs like SNRIs are like venlafaxine, desvenlafaxine, duloxetine, venlafaxine, and levomilnaceparan. Whereas non-epinephrine reuptake inhibitors was atomoxetine, reboxetine, and viloxazine. So these are all the few drugs commonly used as this one. And apart from these, the other some commonly used drugs also is available, like gabapentin and pregabalin. They are also known as the alpha and gamma ligands. So they bind to this subunit at presynaptic and different places, okay, and block the release of excitatory neurotransmitters like glutamate. So we have seen earlier the glutamate also is one of the receptor responsible for formation of anxiety. So they usually block block the release of excessive glutamate neurotransmitters, and that's how it controls the anxiety. And also they are also used in social anxiety disorder and panic disorder quite oftenly. And also some other drugs like 5-HT1A receptor partial agonist, as I told, buspirone, which is also used in the testing of uh, the drug, okay, 5-HT3 involved or not. You can see that increase in prolactin after using of buspirone. You have to check it. The other drugs like MAO inhibitors, like sertraline, macrolide, all those things also can be used here. And hydroxyzine, it's also in the psychotic drugs which are antihistaminic properties which has, okay, and also it can be used here. And antipsychotics can be used, but there is a limited evidence and a lot of side effects are there, so they are usually restricted for antipsychotics. Whereas propranolol and oxyprenols they also use, so they are licensed to treat anxiety. So it's used in PTSD also, quite common. So that's all about the pharmacological treatment of the anxiety disorders. But here the psychotherapy means it's a different kind of treatment than using the pharmacological substance. So the psychotherapy is a thing where more of the counseling of the patients and a lot of behavioral aspects of the patients it comes. So many of in controlling this anxiety disorder, psychotherapy with pharmacotherapy is combined both in the anxiety disorders. And a lot of studies it states that the combination of these two kind of therapies will improve the outcome of the treatment, anxiety treatment. And you can see quite number of articles were published on this, adding psychotherapy to the pharmacological therapy in anxiety disorder. And there are many psychotherapy nowadays, but very importantly, it is classified into three main types. One is behavior therapy, the second one is cognitive behavioral therapy, and third one is psychoanalytic psychotherapy. So these three main under classifications we study about the therapy, uh, the psychotherapy for anxiety disorders. In behavior therapy, we have again sub-classified into different aspects. The one is the exposure and response prevention, like desensitization, systematic desensitization. See, this is the one thing, desensitization, the word we use very commonly. So when it is repeatedly causing some sensitivity of the for any compound, so we do the desensitization technique that we try to give the small amount of safe compound for repeatedly for, yeah, repeat it for again for frequently for some more times. So during that time the sensitivity will get lost and get desensitized. Once it is desensitized, then later on even if that compound is used, then it not cause any sensitivity reactions. So even for like hypersens for penicillins, there is a sensitivity, we can desensitize the patient. Once desensitization is done, again penicillin can be given. The same way any other drug, person is hypersensitive to any drug, desensitization can be done. And so same here for any kind of stimuli, systematic desensitization is done. And also implosive therapy or flooding, it is also in thing like they try to avoid the exposure and any response to any kind of things. That's what involved in implosive and flooding the thing. So they try to make the person come out of that circumstances. So many times the person will not share some event with other people, but here they again they try that everyone knows about this, then the person may get relaxed. So that's what the implosive therapy and flooding they do it in the kind of the treatment. And also anxiety management, which is relaxation technique like yoga, Zen, Mar, that is different kinds of again yogas. Okay. Also few biofeedback. Biofeedback is again they talk about people like how you are there in the thing. So a lot of feedback to the persons else like how he has to be, because he himself cannot be a good evaluator of himself, how I was there with the public or not. So the biofeedback, they does it. How's mm, the especially the way he talks or body language and all those things. And desensitization of the stimulus they done same like earlier, like exposure and this one. And eye movement desensitization reprocessing and social skills training. These are all the few things other behavior therapy they teach how to behave in that way. And the other one is the cognitive behavior therapy. This is also called it as CBT. Okay, so you can see that how the cycle of anxiety causes the thoughts to create feelings, feelings create behavior, and behavior reinforces thoughts, and again thoughts create feelings. So there is a very cyclic way of the how the anxiety usually occurs here. So what is the CBT is it breaks down here. Okay, so it doesn't allow to finish something happens. Okay, so the thought process can be broke because don't think about that, and also the feeling of that may also you can make it as the breakdown. Okay, not to feel of that event for a longer time. So it's a control of automatic thoughts, the correction of any cognitive errors, also breaking the association between the events, cognitive errors and maladaptive behavior. This is what the very important CBT therapy. Here also they do a lot of thing the CBT therapy. They counsel the patient. Okay, so some patients are so sensitive that small things. Okay, so they feel take it as very lightly, very strongly to their mind. So they usually counsel that how to break that thought and also the feelings. And the other one is the psychoanalytical psychotherapy. So it's also involves in kind of any repressed memories are there to bringing that and feelings by making an hidden meanings of verbalized material, and also any kind of ways that unwitting ways saying that what of underlying conflicts, mainly like defensive forgetting repetition of the past. So they remove whatever they try to have the past thought coming again. So this psychologically they analyze that and see that how the person is recalling the past one. So they try to remove that. So that's the psychoanalytical psychotherapy. So it's again there is four types classifications. So we call as the conscious mind and pre-conscious mind. There are different things where the persons think of that, and also there is also an ego which comes under the conscious mind. Okay, so in any kind of traumatic anxiety or like panic attack, ego becomes paralyzed. So because of this, the hello. So there is also separation anxiety, which is separate from loud or valuable objects, or also castration anxiety, where loss of loud or valuable object, and super ego. Ego is again we know like any kind of they feel like they are only the superior and they doesn't want others to be overtaking them. Such kind of the ego activities will comes into that. So depending upon on all these, there is a pictogram developed here. You can see that uh, we have two thoughts like there is an unconscious or subconscious level, there is a pre-conscious and the conscious mind. Okay, so conscious mind always makes a better the process, thought process, and do all the good and take the decision as per the situation. Okay, and there is also an unconscious mind which always provokes, okay, to make that, and there is also a pre-conscious before taking any conscious things, the thing. So what happens here is the impulses from this unconscious to preconscious, it has to reach the conscious to make a judicious the you can make any what we call it as any um, maybe a feeling or your response or take a decision time. So but there is a strong ego here. Okay, so when there is a strong ego here, so it does not allow the impulses from this unconscious to preconscious to conscious, does not allow this ego to reach this to conscious level. Okay, so in this psychoanalytical technique, what they usually do is they remove this ego. Okay, so when they remove this ego and when it is weak, okay, and it will fails to suppress it. So earlier we can see this was strong and it was suppresses them, but here the ego, if you remove that, then this mind thought from this to conscious level get contacted. So because of this, it usually gains access to the conscious minds. Okay, so by this the anxiety psychoanalytical, this one it is mainly it is caused. And the lastly, there is also an anxiety disorder, how to manage at the pharmacy level, and it's a very summary type. It talks about the anxiety, what is that will be on day, and the generalized anxiety disorders in the pharmacy. You can see the first line drugs is again the SSRIs or benzodiazepines. So these are all the first line drugs in generalized anxiety disorder. But the other drugs, they also are there like gabapentin and glutamate receptor, SNRIs and buspirone, but they're not much used. So SSRI and benzodiazepines, because they act on both fear and worry. So this is most commonly seen in generalized. So that's why it is used. The second line they also use the tricyclic antidepressants. Okay, which is commonly used than the mirtazapine or trazodone or spark is there. And also the third line we use psychomimetic as known like CBT, cognitive behavioral therapy. So they are also used, and many times the pharmacological and non-pharmacological is combined in if it is not controlled by pharmacological system. And the next event is social anxiety disorder. In social anxiety disorder, you can see that it's a more of the more than the fear, the worry is more, and that's why it's used SNRIs here more than SSRIs or benzodiazepines. And also MAO inhibitors, second line it is used. And obviously in third line we use as an adjunctive therapy, as combination as CBT, cognitive behavioral therapy. And in the panic disorder, the benzodiazepines and SNRI combination is commonly used. Both the thing, but they usually avoid SSRI because they may having a lot of side effect profile also, and does not have, because when benzodiazepines they use, it's not much helpful and it is there. And tricyclic antidepressant second line is used that, and also CBT. Cognitive behavioral therapy is as an adjunctive therapy is obviously is used as a third line. And for post-traumatic stress disorders, so SSRIs and SNRI both use, they usually avoid the benzodiazepines here. So it's not required here because of it's just a stress kind of things than more than the anxious things. Also, tricyclic antidepressant the second line is used, and cautious with benzodiazepines used. And the CBT also again, like for any as a third line as an adjunctive therapy, CBT is quite commonly used. And there is also a recent advances in anxiety disorders. New drugs has come. They are called as NMDA agonist. Okay, so they also controls the neurotransmitters which causing the anxiety. So they are called as like D-cycloserine and also memantine. So these two drugs are very commonly used. Okay, that's all about the anxiety disorder. So we have seen what is anxiety disorder. We have seen the different neurobiological systems, neurotransmitter systems. We have seen the signs and symptoms, and also we have seen the uh, the investigations, the management, pharmacological and non-pharmacological management, and we have seen the psychotherapy also, and the new drugs and what all the drugs which you have to use specific neurotransmitter things. Okay, so any questions?
No,
No,
sir.
sir.
No,